What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to season 4 of the Birth Squad podcast.
We're Dr. Ijama Bello and Dr. Kamisha Thomas. We are two OB-GYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to season 4 of the Birth Squad.
Okay, so in this episode, we're going to talk about a very realistic situation that happens in the labor and delivery room. You're being told to start an intervention that maybe you weren't expecting to, or you also don't really understand what it's for, right? So let's paint the picture. You're in labor and your provider says, hey, we need to start this medication called Pitocin, right? Or they're like, let's go ahead. We got to check your cervix right now. Or even they say, I recommend we do this right now. But then something in you hesitates, right? But instead of asking questions, you just say yes because you didn't want to seem difficult.
Yeah.
Or worse, you feel like you don't want to put your baby's life at risk. However, you haven't taken the time to actually understand what is happening and why it's happening because you don't want to create tension within your care team. So today we're going to give you a framework that's going to change that entire conversation about how you can be informed and make an informed decision.
So there are a lot of situations in labor and delivery where things are going to happen rapidly and we're going to make a suggestion or an intervention that you might not have anticipated, right? Maybe your baby is small and we walk into a room and we're like, we need to induce you early. Or maybe your water breaks, but you're not having any contractions and we're saying, hey, we need to start Pitocin so that we can get you to contract more so that we can have a baby. Or maybe a nurse just comes in and is like, hey, I'm the new nurse coming on shift. I just want to check you to see where you are so I know where we're starting for my shift, right? And let's be honest, medicine creates a power differential, and we don't always feel comfortable addressing that, maybe speaking up for ourselves because we've never been in this environment or in this situation before. So sometimes it's the way it's presented. It's presented in a way that is it sounds like the expected next step, and it doesn't seem like it's a choice. And so you feel pressured to agree quickly. And what we want to do is explain what's happening in that moment and give you tools for ways that you can respond that honors your autonomy.
Right. So I think it's very important to acknowledge too that while labor and delivery is an unpredictable and sometimes scary thing, oftentimes things don't have to happen as fast as it may be perceived, right? Most of the time, there is time to actually say, I need a moment and I need to think about this before I give you an answer. There are, very few situations where, it's truly an emergency and this needs to be done right now. And to be honest, you're going to know, right? You're just going to know that that is the situation. But a lot of the times, there is some time for you to actually process what is going on. And so that way you can have a full conversation. You can be part of it and understand why and what your options actually are. So we want to kind of just make sure that you understand that you don't have to be under this time pressure, right? And so having a conversation so that you're informed, I think is really important. So we're going to describe to you this really amazing tool. It's called the BRAIN tool. Okay. So I want you to remember it. BRAIN. Okay. Dr. Thomas, you want to break down what the B stands for?
Yes. So we're going to start by saying it's okay to feel uncomfortable because we understand that saying no can be hard. And so the first thing we want you to think about when we talk about the BRAIN tool is, what are the benefits of doing this right now? Right? You're not saying, no, I don't want to do that. You're saying, I kind of want to understand more, right? So what are the benefits? The next letter stands for, what are the risks? So what are the risks for me? what are the risks for a baby? And I think that's a really simple, straightforward question that should not make us uncomfortable and shouldn't make your provider feel like you're giving pushback. The other acronym or the other letter in the acronym A stands for what are the alternatives? Can we talk about some of the other options? I would like to consider some of the other options. I stands for your intuition. Like, what does your intuition tell you? How do I feel about this? Does this align with what I want? And then N is nothing. So, what happens if I do nothing for now? And literally, I promise you, this happened to me when I was working last night, right? I walk into the room. I told the patient, hey, I think we should break your water so that we can continue the labor process. And she said, I just need 30 minutes to kind of process that. And I said, okay, right? That's not unreasonable. And we want to help you feel empowered to use this tool so that you feel like you're not being rushed into any decision that you're making.
Yeah, I mean, I wanna say this very clearly, right? Very clearly, that those questions really help put you in a position where you are asking questions that your provider should be able to answer, right? So, when someone or, as part of the team is presenting you with something that maybe you don't understand, just saying no doesn't mean that you're advocating for yourself. What using that brain tool is actually the way that you advocate for yourself is helping them help you understand, right?
Exactly.
It shifts the entire dynamic. It's actually creating a conversation rather than you being told what needs to be done. It now puts you in the seat to make the decision because you now understand what are the benefits?
Hmm.
What are the risks? How do I feel about this? That intuition part I think is so important, right? And what are the alternatives? And good question. I think the last one is so important. What happens if we do nothing?
Hmm.
Okay? Because that way you know what the opposite is, right?
And you can use this in clinic or on labor and delivery. And what does that look like in a clinic setting? So commonly I'll get patients in the third trimester saying, with my last pregnancy, we did cervical exam checks, right? When is that going to start? What information will that give us, right? If you check my cervix today, will that change management? If your provider offers you a membrane suite, what are the benefits of doing that today versus waiting, right? Your doctor offers you an induction. What are the risks of continuing the pregnancy versus getting induced right now, right? So this tool can translate to multiple settings, and we want you to use it to help you navigate the healthcare environment so that you are being heard. Because that's the big thing that we see, especially in minority populations, is that our voice is not heard and our desires and our wishes are maybe being overlooked, or we just don't feel comfortable in the environment that we're in to advocate for ourselves.
Yeah. And so I want to go back to something I alluded to earlier, right? Something that to be clear about is that not every moment does allow for these long conversations, right? When something becomes medically urgent, unfortunately, the timeline changes. Your provider may need to act quickly, but even then, you still deserve a brief explanation of what is happening and why, right? The difference is in urgent situations, options may be limited, but at least you understand that.
So I think, ultimately advocating for yourself doesn't mean creating conflict. And that's the message that we want to convey in this episode. It means that you're maybe asking better questions because not every intervention has a benefit, right? And so we just want to make sure you're going over the alternatives. You understand you have a choice about timing and that you realize that when you understand that, we hope you stop feeling powerless.
Yep, and you can participate in your care, clarity, and
Mhm.
collaboration. Not feeling
Mhm.
rushed, not being pressured, but being informed. And truly, that is what changes everything. So, this is your blueprint.
We can't wait to keep talking about more issues like this with you guys.
Till next time.